try it again. Okay. Take two. All right. Hey, we have sound now. I'm Randy Murphy, Epidemiologist, Director of Disease Surveillance at the Mobile County Health Department. Today is Thursday, August 26th. We were able to publish our daily report today, although it is missing Figure 1B. So the state has been able to get some data systems back online and functioning as they were, but not everything. So we will continue to provide you with the information that we have available, even though we have had to publish an incomplete report. So as of yesterday, there were 61,781 cases of COVID-19 reported in Mobile County residents, and 1,007 Mobile residents have died with COVID-19. It's very grim mark to go over the 1,000 mark for the number of deaths in Mobile County residents, and it will continue to go up. The cumulative number of people hospitalized with COVID-19 is 7,625. An additional 44 people were admitted to the hospital yesterday, and in the hospital yesterday was 426 people. So it does appear that the number of hospitalizations with COVID-19 is stable, has been stable for some time, for a couple of weeks now, is coming down a little bit. So we were in the 480s just 8 or 9 days ago, and we have been in the 420s for the last 3 days. So we will take what we can get. I know that every vacant bed is crucial for the hospital hospitals who are dealing with just an overwhelming demand for hospital care, including COVID-19 and all of the other people that they're trying to take care of in the community. I want to remind you again that the largest age group, the cases, we see the most cases from the age groups about 18 to 50, but we are seeing a large number of children who have been diagnosed with COVID-19. So in school-aged kids, that's between, 5 for pre-K and 18, about 15% of our cases are in school-aged children. And those are just the ones that are reported to us. As you know, many rapid test results are not reported. So we are hearing about, classes being affected, daycares being affected, schools being affected. So we do have a lot of action, a lot of transmission that is happening both in school-aged kids and in schools and after-school activities. It's interesting. I'm very proud of Mobile County Public School System for continuing to publish daily the number of people, the number of students with COVID for each of the individual schools on their public website. So Google Mobile County Public School System, go to their COVID-19 information page, and there you will be able to see, each day the COVID report by school, by specific school, that will tell you the number of students that are excluded from school on any given day for COVID reasons. So take a look at that. And again, please do not send your children to school if they have COVID or if they have been around someone with COVID. They should be excluded, except for a very few rare exclusions that they could still remain at school if exposed, if they're vaccinated, or if they were exposed in a K through 12 setting and both the student with COVID and the exposed student were both wearing well-fitted masks and they were worn continuously throughout the exposure period. This is probably a very rare thing for kids, but certainly there are some adolescents 12 and over that are fully vaccinated. So if they are exposed to COVID, they can continue to go to school in person. All right. A couple of questions. I spoke to a news outlet earlier today asking about some of the vaccinated versus unvaccinated data. So we know consistently in our hospitals about 85% of the people that are hospitalized are unvaccinated. About 95 to 96% of people who die with COVID are unvaccinated. So it is still really important that you get vaccinated to try to reduce transmission, but also primary reason to reduce the burden of illness. So keep people who do get COVID from having severe complications that will require hospitalizations and then might lead to death if they have underlying medical conditions or are immunocompromised that might make it difficult for them to mount a proper immune response and to survive a debilitating illness. So again, let me just briefly again try to explain what's going on with third doses and what is being discussed with booster doses. So right now, what has been authorized is a third dose for people who are severely immunocompromised. And examples of being moderate or severely immunocompromised are undergoing treatment for cancers, being a transplant recipient, having had a stem cell transplant in the last 2 years, having an immunocompromising condition, something that puts you in a situation where your immune system cannot fight off disease, and then taking long-term high-dose steroids. So those are some of the examples of moderate to severely immunocompromised. These are people who have difficulty mounting an immune response to any vaccine, not just the COVID vaccine, but to any vaccine. So that's why FDA has authorized a third dose for those people. For them and for everybody else that has completed our primary series, so for most people, your primary series, completing it means you had 2 doses of Pfizer, 2 doses of Moderna, or a dose of J&J. So there is growing evidence or growing facts or data to suggest that we would benefit from a booster dose around 8 or 9 months after our primary series was complete. So it doesn't necessarily mean that our immunity is waning to the point that we have no protection. That's not it. It's just that the data are showing that we would benefit by getting a boost to help our immune system get back up to that really high level of protection, 95% or so for Moderna and Pfizer. And again, this is not a failure of the vaccine. There are many vaccines that we have and are familiar with that require more than 1 dose, and often you need a booster dose. So things like measles, mumps, and rubella, that's a multi-dose shot. We have to get a flu shot every year. We get tetanus every 10 years. That's something that we have to help our body with. So this is not uncommon or is not just a feature of the COVID vaccine. There are other vaccines that require either multiple doses or require a booster at some point in life to help us boost the immunity that we had to the primary series. So someone commented on Facebook that that people who are unvaccinated, it seems most unvaccinated people in Mobile assume that COVID infections are mild. So I think that's true. I hear a lot that I'm young and I'm healthy and I just don't think I'm going to get that sick even if I do get COVID. And maybe you won't. Maybe if you're 27, 28, 32, maybe you'll get COVID and you'll be just fine. But for those people who have lost wives and husbands and fathers of that age, for them, it is very serious. And it can happen to anyone. It's just we all react so differently. The best thing to do is not take a chance. Don't take a chance that your child will have to grow out without a dad or a mom. Don't take a chance that you won't be able to care for your parents when they're older because you didn't get vaccinated to protect yourself now because you thought you'd be okay. So don't risk it. Don't take a chance. Don't gamble with whether or not you will have a mild or a serious case of COVID-19. Get vaccinated and give yourself the best opportunity for a mild illness should you get COVID. So here's a question, I think for an employer, if a coworker tests positive and I'm in direct close contact with them multiple times a day. So close contact is defined as within 6 feet for 15 minutes or more in a 24-hour period. So if you were around them for a cumulative amount more than 15 minutes within 6 feet, then you fit the definition of a close contact. You should go home and for at least 10, preferably 14 days. Someone asking if the Mobile County Health Department does antibody testing. We do not. Would I send my kid to school? That depends. Depends on if my kid was old enough to get vaccinated or not. If he or she were 12 or older, I'd get them vaccinated and then send them to school with a mask and a good understanding of hand hygiene and staying, keeping a distance from people that aren't vaccinated. If my kid wasn't old enough to be vaccinated, then I would consider rates of transmission in the community, how much COVID is at my kid's school, how well they're able to wear a mask throughout the day, whether or not their teacher is vaccinated, and those sorts of things. I would gather that information and then try to make the best decision for my child. So someone asking, how long should someone wait to get vaccinated after they recovered from COVID if they didn't have an infusion or convalescent plasma? If you have COVID and you go through your 10-day isolation period and you're feeling well, then go get vaccinated on day 11. People are supposed to stay at home for 14 days. Okay, this bullet here is mixing some concepts. So if you have a positive test, you stay at home for 10 days, then you can go back to work or school. If you're quarantining because you were exposed, if on day 14 you have no symptoms, you can go back to work or school. That's pretty clear. It is to me because I say it 14 times a day. All right. We're going to cut it off here today. We have a couple of appointments this afternoon we need to get to. We will, again, do our best to publish our daily report tomorrow, even if it's incomplete, because we know you guys are looking for it. Please stay safe out there. Get vaccinated. Wear your mask and distance from people that you don't know. Stay at home if you're sick or if you have been around someone with COVID. This is the only way we can stop the current outbreak in its tracks or have any prayer at slowing it down other than just naturally letting it burn through. So please, please do what you can to try to help us slow this very alarming high number of COVID cases, hospitalizations, and deaths. We'll talk to you tomorrow.